We report on COVID-19 hospitalizations every day, so for some it can be easy to just tune it all out. But behind every statistic is a story. For Martin Taylor, his story began at a WakeMed back in July, and it's one his family doesn't want anyone to ever forget.
Oh, it's been a journey.
A journey that began with COVID-19 symptoms that quickly escalated.
He could barely walk. He was leaning on me, and I figured that he was gonna, overcome them little symptoms, but no, it didn't work that way.
Admitted to the hospital in early July, transferred from WakeMed to Duke. The days turned into weeks, turned into months.
He had multiple complications and a very, very prolonged course. He had bleeding.
Multiple surgeries, infections. Martin says he was unconscious for most of it, receiving oxygen, plasma, and eventually put on life support.
And the doctor, they called me late that night and told me, your husband, he's not going to make it throughout the night if we don't put him on the ECMO life support. He wasn't going to make it through that night. So I told them, I said, y'all do whatever y'all have to do, to save my husband.
Dr. Rackley estimates only 23 of Duke's 2,000 COVID-19 patients have required ECMO.
He is the longest survivor who has required ECMO support for lung failure and did not need a transplant. For 69 days, he had his blood leaving his body and going through an artificial lung to keep him alive.
All the while, his family hoping and praying.
The roller coaster of emotions of depression, anxiety, a lot of just feelings of helplessness, I guess you could say, because you really couldn't go see him.
The Taylors say their faith in God, Martin's willingness to live, and his medical team led to his recovery. In the last week, he's started rehab and says he's getting better every day. A recovery that's already sparking hope in so many.
It's inspiring. I think I can speak for a lot of healthcare workers when I say that this has taken a huge physical and emotional toll on all of us. And we've seen a lot of people die. We've seen a lot of people die very, very lonely deaths in the hospital because you can't have your families visit you. And to kind of remember cases like his where, he was critically ill for so long and his outcome was so uncertain for so long. To see him walk out of the hospital after that, we have to remember cases like that to sort of keep us going.
Martin doesn't want his long battle to be forgotten.
But this is nothing to play with. I was healthy, doing good, and when it hit me, it just knocked me down. So people really need to take heed with this.
In Wake County, Samantha Coomer, ABC 11 Eyewitness News.
Martin Taylor's long road to recovery. Samantha, thank you. And tonight, the I-Team taking a closer look at the people hit hardest by this virus. The latest data showing 78% of hospital patients are older than age 50. We've also seen an increase in the number of white patients with COVID, while the portion of Latino and Black patients has declined. Despite those shifts, Black people are still disproportionately impacted by hospitalizations.